everyone and welcome back. My name is Fab and in this video I'll be talking about how you can ace your Viva. Viva is a one-on-one interview that you do with the examiner and it lasts for about 10 minutes. It's a situation whereby you're called in one by one and then you have to sit in front of an examiner and they ask you questions on various parts of nursing. These are the tips I'm going to give you on how to face it. First of all, be confident, be calm, breathe before you respond. Or anything that you do that always keep you calm. For me, breathing works. Whatever works for you that keeps you calm, do it before you respond to the question. And when you're asking the question, ensure that you understand the question before you answer. Now, the areas that you can expect questions on during your Viva include models, instruments, drugs, your project, and your case study. These are the areas that you can be asked questions on during your Viva. Now, I will break each one of these down. For the models, these are the organs that you will mostly find in an exam setting. So you can find the model of a skin, kidney, stomach, lung, liver, skull, brain, spinal cord, mouth, and teeth. You can find the model of hair, eyes. Then you can actually be asked to describe the model of a skeleton. How do you go about answering questions on models? You follow this order. You first of all identify the organ. Oh, this is the model of this. And you define the organ in terms of location. Oh, this organ is located at the so aspect of the body. It does this. Then you state the function that is in the definition. So when you're defining, you define the organ, you state where it's located and the general function. Then you now relate it to its system, that what system does this organ belong to. Then you describe in terms of size, shape, location, and then its function. Then you can talk about its boundaries, anteriorly, posteriorly, laterally, superiorly, medially. You can talk about the structures, layers, the walls, the chambers, the valves, and then you finish it off with the clinical correlation. But the examiners might ask specifically what they want, but most times they leave blank check, like identify this model, or tell me about this model. So you follow that order in explaining to them about the model they pick for you. Sometimes they ask you to go and pick the model. So pick the one that you are very sure that you can describe very well. Now, depending on the model you are describing, you might not necessarily follow the order. For example, for skeleton does not have chambers, does not have layers or valves. So you don't need it. But when you're describing art, of course, you have to state the chambers, the valves of the art. So depending on what the model is, you follow the order that I mentioned to explain it based on what it has. Now for the instruments, you might be asked, go and pick this instrument, or go and pick any instruments you can describe. So how do you go about explaining the instrument? So you first of all describe the instrument. Oh, this instrument is this. Then explain how to use it. It is used to, then you demonstrate its use, and then explain its significance in patient care. And also ways in which you can sterilize the instrument, or ways of keeping the instruments before and after use. So it's very important for you to also note the differences in instruments that look alike. For example, needle forceps and artery forceps. There is a groove in needle forceps to hold the needle, and there is no groove in artery. So the examiner might even tell you to go and bring the two, then come and explain. So know if you know the differences between these instruments. Let's go on to drugs. If you're asked to go pick a drug, what are the things or what are the ways in which you can explain the drug? You first of all start with the name of the drug, the class of the drug, mechanism of action, its uses, forms and availability, dosages for adults and children, side effects, and the contraindication. These are basically what is expected from you when you are describing a medicine or drug. If you are asked to talk about your project, it's expected that you did your project yourself. So the summary of your project is from your abstract. Learn your abstracts very well. Know your topic, because you might be asked, what's your topic? And that way they will know if you did it or not. Because if you are the one that did it, of course you will know your topic. Then know the objective of your topic. Why did you pick the topic? Why did you do the topic? Then it's very important for you to know your chapter 3 in terms of data collection, what you use to collect your data, basically. And then from your topic, know the independent variable and the dependent variable. Then you might be asked, like, what forms the basis of your project? That is your chapter 1 to 3. Is your proposal as well. So you might be asked how you carried out your proposal. You might be asked how you got consent to carry out this project. So basically your chapter 1 to 3, be very familiar with it. And be very familiar with your 4 and 5 in terms of the results of your data, your recommendation, and your conclusion. Now, for your case study, Know your case, know the name of your patient, why did you choose the patient, how did you manage the patient, and then what were the follow-up method that you did. So that's basically the summary of your case study and what you might be asked. You might not be asked everything I just listed. You might be asked one, you might be asked two, and you might be asked everything. That is where Viva becomes tricky, because you won't obviously be asked all of these things because you have 10 minutes, but you don't know exactly which one the examiner you'll be assigned to would ask you. So if you prepare for all of it, and when you're asked, you'll be able to answer it. So if you have any further questions or maybe gray areas in what I've said, you can ask in the comment section and I will clarify. So don't forget to like, comment, share, and subscribe for more videos. Thank you.